Just a minute, we need to check the audio visual.
वो वीडियो प्ले नहीं हो रहा है शायद. It's just showing the thumbnail.
Yeah, that's what it's not.
Yeah, it started.
Okay. Just give me a minute to let me check the live chat as well. Okay, seems good. Right, so hello everyone, here we have Dr. Akanksha Nag, and who secured a rank 9 in INI-CET in her very first attempt after her internship. That was the very first attempt. But then the surprising fact here is after getting INI-CET rank 9, she took up general surgery at AIIMS Delhi, but then she resigned from there. Then she gave the NEET PG. She got All India rank 15 in NEET PG 22. She gave INI-CET mid-year 2022, and again she got a very amazing rank of rank 39. And now she is pursuing MD radio diagnosis at AIIMS Jodhpur. Right, Akanksha?
Yes. Good evening, ma'am. Good evening, everyone who is watching this session.
Yeah, I forgot to congratulate you for this awesome result. I have done it in the past personally, but this is like sabke samne, and I wanted to do it since so long. And also I want to tell everyone that I have a very personal connect and a special connect with Akanksha, because she's my junior from Sion LTMMC Mumbai. I have done my MBBS from the same college, and so we resonate on that fact that cyanides are dynamites, right?
Definitely.
Yes, Akanksha.
Yes, ma'am.
So welcome so much, welcome to this session, Akanksha, and the very reason that I plan to do it now is because now that the NEET PG 23 is done, and I've been getting my inboxes all flooded with now how to prepare with INI-CET. We have less than 60 days, less than 2 months remaining. So I thought, the best person to guide on this would be, of course, you, because who has been in this journey very recently. So you know the trend, the recent trend that's ongoing, and what would be the best thing to do in these last 2 months. So we would like to know all of your insights and the secret tips that helped you crack any exam that you appeared for. And before that, I'm pretty sure that everybody here would be eager to know that after getting INI-CET rank 9, why did you give the NEET PG and the INI-CET again?
So when I had left general surgery at AIIMS, I was not happy with the course over there. So I had actually left to join surgery through State College, that is in Bombay. So I was preparing with NEET PG in mind. But again, NEET PG had gotten postponed, so I happened to give INI again. And NEET PG, which happened after a gap of 15 days, I gave both the exams. And then I later switched to radiology because there was a lot of delay in counseling, and I decided, like, I spent more time. I happened to stumble upon interventional radiology when I was there pursuing my residency in AIIMS Delhi. I used to get a lot of IR procedures done for my patients, and I spent more time in cath lab during my pre-counseling phase. So it was a big decision to switch the branch, and still radiology is very new to me, but I'm learning each and every day, and it gets better every day. I think there's a huge learning curve for radiology because we are not much exposed to it during our undergraduate days, but it's really very wonderful, and especially the interventional part of it is really fascinating. So I'm currently in second semester. I'm doing my MD in the Department of Radiodiagnosis and Interventional Radiology at AIIMS Jodhpur. So we have it's one of the best programs of radiology in the country. The diagnostic as well as the interventional part of it is extremely good. We do interventions head to toe, everything.
So I mean you are a perfect example of for everyone to say that please follow your heart. I mean it would have been so difficult to take that decision of getting INI-CET rank 9 and pursuing surgery at AIIMS Delhi and then to leave it. I'm pretty sure that it must have been very difficult, but at the same time now I can see that smile on your face and the satisfaction having joined radiology and following your heart. So the first message for everyone here is please follow your heart. whatever your heart says, your heart somewhere knows what you want to really do, so please follow that. So this also applies to your whether even if you get a good rank in NEET PG, you still want to pursue INI-CET or vice versa, just follow your heart. So Akanksha, coming to the preparation strategies, I mean, it's super awesome that you cracked the exam in the first attempt itself. The INI-CET rank 1 in first attempt is like amazing. So first of all, we would like to know that now the students have less than 2 months, like I said, for the upcoming INI-CET. So how should be the strategy? How should they plan their days? How many revisions and how everything should be done?
So before moving to the strategy aspect, I would like to talk about why one should prepare for INI-CET. Now we know, according to the recent guidelines, the last day of internship completion itself for NEET PG has been stretched till August. It means that NEET PG counseling is not going to start before September. So there's a lot of gap, and and even if somebody who is an intern right now, they can resume their internship after giving INI-CET, and still they will be able to complete their internship before the cutoff date. So there is an ample amount of time. And the INIs, they have several advantages that everybody knows. The first advantage is the tag which you get, and a tag of a central institute gives you a lot of credibility, which goes a long way in someone's career. Secondly, the stipend definitely is high, there is no bond. But the most important thing about central institutes is the kind of training which we receive over here. We don't see it in other kind of places. I would use the word, there's a lot of quality training which we get at the INIs, which we don't get much at state colleges. So these are the main advantages which one should keep in mind, and that is why they should prepare for INI-CET. Second thing is, I have received a lot of messages about people saying that their NEET PG did not go well. So I want to tell that there is no correlation between the rank of NEET PG and how you will perform in INI-CET. It has to be approached. There has to be a fresh approach for the exam. NEET PG is entirely very different, whereas INI-CET is entirely different. So INI-CET has a pattern of topics which they repeat again and again, and these topics are sufficient enough to get a top 100 rank. So any AIIMS paper you can pick up, you can divide the questions into three categories: the easy, the moderate ones, and the difficult ones. So the difficult ones you're supposed to leave. In fact, if you attempt them, it will contribute to negative marking and your rank will go down. Difficult questions of which you have no clue about, for example, half-life of letrozole. Nobody knew the answer to that question, so it was supposed to be left. The easy questions are the banking questions. The easy questions comprise of direct one-liners which are at a reflex level, and the PYQs. A lot of previous year questions are directly repeated in the INI-CET exams. So we will come to the PYQs approach later. So we have the difficult questions which are supposed to be left, the easy questions which have to be attempted very promptly, and the moderate level questions is what, according to me, determines the rank. So the moderate level questions are also from the commonly repeated topics, but they require a more analysis of the options and ruling them out. For example, in my INI-CET, there was a question of a 34-year-old banker who presented with an incidental renal mass, and they had given a CECT abdomen. And long time back, there was a previous year question where they had given same scenario and the answer was angiomyolipoma. So everybody had marked the answer angiomyolipoma. But I remember clearly very well, it was showing enhancement and it was not a fat density lesion. So I had marked the answer as RCC, and that was what the answer was. So such kind of questions require critical thinking at the time of exam analysis, and they will push your rank ahead. There was another question of stroke. They had given a stroke in window period, but they had not given the option of thrombolysis. They had given one of the answer was to perform a CT angio with perfusion, and that was what the answer was. So you should know the stroke is a very commonly repeated topic. So these are the moderate level questions which will actually, make you push you to a single digit rank or a top 50, top 100 rank. So any AIIMS paper, this is how the typical pattern is. The second thing which is different between AIIMS and INI is the time. In NEET, we have 3.5 hours, we have 200 questions. So we can go at a good pace. and still we will have a lot of time to review them. But in INI-CET, you have the same number of questions which has to be done in 3 hours. So there's a lot of time crunch, and under that time crunch, we are bound to make silly mistakes. So your PYQs are your reserve bank. Like, they will save you a lot of time, which I was saying previously. So this is like the general approach for the INI-CET, how it is different from NEET exam.
And so also I believe that in INI-CET the questions which are kept for review are not considered. They are not.
Yes, they are not considered at all. So the major drawback, the major challenge is time crunch, and in time crunch we make silly mistakes even in the questions which we know, and we unnecessarily take up a lot of time in critical questions. If you're not able to diagnose and rule out options, leave it, come back to it later if you get time, and solve the remaining solvable questions, which will give you +1 marks.
Absolutely. So you mentioned like PYQs are like the boss here in INI-CET, yes. And I myself have seen it recently, like so many questions direct are repeated. So what do you think are the good number of years PYQs that should be done?
Actually, in last 2 or 3 sessions, a lot of previous year questions have come from the old AIIMS paper, like the 2013, 15, 14 उस time के AIIMS के paper से आए हैं. So one should actually solve last 10 years PYQs if they get time. So right now, like today is 11th of March. So by mid of April or by 3rd week of April, one should finish one complete revision based on the PYQ topics. Then they can do another revision in the last 15 days of April, and a third revision they can do in the starting 1 week of May, like the first 6 days of May. So 3 revisions can be done. So what one has to do is they have to take the previous year questions. There are various platforms on which previous year questions are available, and whatever topic is present in that. For example, there is AIIMS 2017. There is a question in which they have marked lateral pterygoid muscle and they have asked the action. So there are two things to understand in this question. First, you should be able to identify which is lateral pterygoid, and once you have identified lateral pterygoid, you should know its action. So the topic over here is muscles of mastication, and it is an image-based question, so you should also know how to identify it. So my trick was that the muscle which is going to the temporomandibular joint is lateral pterygoid. That was my trick to remember. So you have to not just read the theory but also see the images, because AIIMS is a very image-oriented exam. So you take the PYQ topics, but you read those PYQ topics from your primary notes only, which you have been reading so far. You don't have to pick up any new material. So apart from that, daily 1 to 2 hours reading of first aid, this is how your timetable should be until the INI-CET exam.
Yeah, I would be coming to the first aid part, but before that, since you spoke about the last 10 years PYQs, and I can see majority of the students have this doubt that, what is the resource for this 10 years PYQs? Because everybody uses the apps, and the apps give the previous year questions from 2017, that is the last 4 to 5 years. उसके पहले के papers फिर कहाँ से करने हैं? What is the resource for that?
So there are 2 resources. First is Dr. Aditya Gupta's Reflex Previous Year Question app. It has the previous 10 years papers. Other one is that INI-CET Essence book by AIIMS Essence by Pritesh Singh. I had used AIIMS Essence by Pritesh Singh when I was preparing for INI-CET. So both the options are available for you. Whichever is suitable, they can choose.
Okay, all right. So now coming to the next part that you were speaking about, the first aid. Now, there are 2 groups of students. One group who has read first aid for NEET PG, but there's another group who has not even touched first aid. Probably they didn't know or they did not get time. So what do you think the students who have not read first aid yet, should they be doing it now? Like it would be a new resource sort of thing. So should they do it right now?
I think they can do only the basic sciences part. The systemic ones they can skip if they want to skip. If they really want to try first aid, they can do only the basic sciences, the anatomy, physio, biochem, micro format का जो basic वाला starting में जो दिया हुआ है, not the systemic ones. They can do the general anatomy, micro, bio and all from that. The reason why first aid is very widely advocated is because unlike NEET, again INI-CET is based a lot on first and second year subjects. They form the core, and the questions are pretty much like you can get all of them correct or 14 out of 15 correct, whereas in case of medicine and surgery you will not have such a high strike rate, because some of their questions are made from research papers and journals, and these questions are supposed to be left, like I had said previously. So somebody who has already read first aid, they would know that it is consolidating all the first year and second year subjects in a very beautiful way, which is very easy to revise. So you can do a passive reading of first aid. Like I used to read it before going to sleep for 1 hour. After my dinner, I used to read it like a storybook. But the active reading should happen during daytime from your primary notes only, from which you are going to revise it.
Okay. All right. So USMLE first aid, that's the step 1, which is important. Nobody needs to go into like the step 2 CK wala book, right? Next question that we have from Abhilasha is a very relevant question. So how many questions should be attempted in INI-CET to get that top rank?
Yes, so definitely you should attempt more than 185 questions. Beyond 185, you have to titrate based on how the difficulty level of the exam will be. So 185 plus is mandatory. You have to attempt to get a good rank. And beyond 185, see how difficult the exam level is. So when I had given my first attempt in INI, I had left 12 questions. I had attempted only 188 because those 12 questions I had no idea about. I couldn't even rule out 2 or 3 options. So I played more defensive in that paper. I got rank 9. In my second attempt of INI, I felt I went a bit too aggressive. So I had attempted 196. So I would have lost more marks, and negative marking is what brought my rank to 39 is what I felt, because I had same number of correct questions in both the exam. I had calculated it. So I for the second time I could not gauge about the difficulty level of the exam much. So you have to see how difficult the exam is. It's simple. Beyond 185, how much you're going to attempt is based on how many unsolvable questions they have put.
Okay, all right. So what do you think, like out of 188 or 196 that you attempted, how many correct did you get?
So in my first attempt, I had around 157 correct questions. In my second attempt also, I had same number of questions. But what I have felt is over the past years, the competition has also increased. Like the number of questions which are being made correct by rank 1 is a lot. Okay. So I have also spoken to my seniors who also had single digit ranks before me, like who were in AIIMS Delhi. They actually had gotten same rank at a much lesser number of correct questions. So that's what I came to know, that with each passing year the competition has also increased. So with the same number of correct questions, one might not get the same rank in the next attempt.
Okay. So basically the Gen Z doctors becoming smarter is what we are seeing. Yeah. Okay. And we have the next question here. The next question is from Kruti is, how did you form the image banks for patho, ophthal or overall? Like how did you cater to that?
So for ophthalmology questions I used to do Radsynapse. Like a lot of videos are available on by a lot of faculty which do image based revision. So you have to see, whenever for the approach to image based questions, you will not get an exact copy paste image of what is given in the coaching class. For example, orphan ani nuclei. Coaching class would have given some other image. The examiner will give AIIMS image only. So you should know how to identify the features, what features you will look for. For example, there is a very common question of a slide of aspergillus versus mucor, and uske alag-alag variations aate hain har exam mein. So just see if septa is present or not, acute angle is present or not. If septa is there, acute angle is there, blind mark the answer aspergillus. If septa is not there, broad based hai, angle nahi dikh raha hai, so you mark the answer as mucor. So rather than just rectifying the images, see what features you will look for in that image if you want to identify. Like one example which I gave just now was RCC versus angiomyolipoma. So my trick was that if at that time I did not know much about fat density lesion or solid component lesion. The trick was simple. If there is black shades inside the lesion which is matching with the subcutaneous fat, I will mark angiolipoma. If it is matching with gallbladder density, it is I will mark the answer as RCC. So these were my features. So that is what the approach should be for exam questions.
Okay, that's really, I can see the topper instinct there. I believe every topper does the same thing. And the next question that we have is how many grand tests, what should be the frequency of grand tests? Dr. Stephen is asking कि कितने grand tests देने चाहिए in these 50 days or so?
You can give 3 to 4 grand tests, and one thing you have to keep in mind is that these grand tests, at least for AIIMS exam, they don't correlate much with the actual rank which we get. The whole purpose of giving grand test is that are you able to solve 200 questions under that time crunch. You have to able to be build a strategy. Like I said कि you have to gauge on the exam day कि 185 के beyond मुझे कितना छोड़ना है या 185 के beyond कितना attempt करना है, तो वो आपको grand test दे के gauge करना है. Now the grand test which you will give it is definitely to tell you what are your weak topics, but most important thing to take from grand test at this point of time is, are you able to manage the time or not? Are you able to gauge how many you have to attempt and how much you have to leave? So these are the 2 additional takeaway points from the grand test which you will be giving. So you can give 3 to 4 grand tests. Various platforms will come up with their mock exams, so you can definitely attempt it, but don't take the ranks too seriously. One of my friend had a rank of 1200 in the mock exam which he had given before exam, and his actual rank in the exam came 12.
So the 0 actually had no value.
Yeah.
All right. So how did you review the grand test? What was your strategy? Did you review the same day all 200 questions, or you did it like in bits and pieces over the entire week? How you used to do it?
No, I used to review it the same day, max to max. It would go on till next day. And what I used to do is review my wrong questions and my guesses. So a lot of grand tests have guess trackers in it. So if I have guessed a question, then I would mark it while attempting it. This is a guessed question, and the ones which I am getting wrong. So those are the topics which I used to write in my notes or add it in my 20th notebook. For example, I used to always make mistakes in calculating GCS. I don't know why, but I had revised it one day before the exam as well. So I had added it in my 20th notebook. So there are certain mistakes which are repetitive, and that becomes your weak area. It is something which I have figured out while giving multiple grand tests. And definitely these are the things which you will revise in the last 7 days. I think that was one of the person's question.
Correct. So what should be read in the last 2 days? Because students do get very anxious and stressed out, और समझ में नहीं आता कि करना क्या है. There's a huge vast ocean there of syllabus to be completed, and then you go like bonkers कि क्या करें पता नहीं. So what should be done in those last 2 to 3 days?
So अभी जो आप लोग first revision करने वाले हैं for till mid of April, उसमें आपको like when you will revise it for the second time, you will realize कि what you're not able to retain, that is something which will go in your third revision, which is 6 days before the exam. For example, like I'll give another example. My hepatobiliary system is very common. Bile duct injuries is a very commonly asked topic in AIIMS. In fact, my professor, our unit used to do a lot of bile duct surgery. So from like that is probably the source of the question. So Strasbourg classification is very important. So I knew this it is going bile duct injury approach, and Strasbourg is going to come in some way or the other. So, and I'm not able to remember it, so it automatically went in what I'm supposed to revise in the last 6 days. Color coding of IV cannulas, Foley's catheter, oxygen delivery devices. These are favorite AIIMS question. Most of the people know what are the favorite AIIMS question. Revise it a day before the exam, because as easy it may look during exam, nasal cannula और face mask दोनों का FiO2 बहुत confuse हो जाता है.
True that.
पढ़ने में चीजें इजी लगती है, एग्जाम में देखा हुआ चीज भी डाउट होने लगता है कि आंसर क्या मार्क करें. सो जो कॉमन चीज है, जो तुम कॉमनली बार बार मिस्टेक्स कर रहे हो, तुम्हें वही लास्ट के 6 डेज में रिवाइज करना है.
Okay, all right. So we get that. And what was your strategy? The next query is ki suppose you have ruled out two options and now you are confused in two options. So you used to do that akkad vakkad or you used to follow your instinct? How exactly did you cater to those questions?
So one thing which I've realized is that we should not overthink much. जितना question में hint दिया हुआ है, they are not. I don't think AIIMS or INI will give you any distractor. Whatever symptom complex they have given in the question, they have given it so that you make a diagnosis and arrive at a particular answer. So use those, everything which is given in the question, you more or less will not have much confusion. I figured it out in when I gave it for the second time. They don't give any distractors. Whatever they have given is pretty much straightforward. Use those keywords, make a diagnosis and mark the answer.
Okay, so we get that. And the next thing I wanted to ask is like, so if I ask you the top 5 subjects or 6 subjects for INI-CET, what would be those top 5, 6 subjects?
So definite first and foremost has to be surgery and OBGY, because surgery and OBGY, they are they actually put up your rank in top 50, because the questions which are asked in OBGY and surgery are management based questions. If you are very thorough with your management, then you will be able to answer those type of questions and you can get score easily. Like if there are 17 questions, आराम से 14 या 15 you can get it correct in OBGY and surgery. During my exam, there were 25 questions in OBGY and I had left only one, and remaining 24 मेरे सारे correct थे, and वो सारे previous year topics के ऊपर ही based थे. तो definitely surgery and OBGY जब आप previous year topic से पढ़ रहे हैं, तो you should not read the theory part of it. You should rather focus more on the management part of it. For example, there is a very commonly asked question in AIIMS that endometrial aspiration cytology पे atypical hyperplasia निकल के आया है. What will be your next step of management? So it is incorrectly given in a lot of books that you have to directly go to hysterectomy. But before doing any surgery, you should have a histopathological diagnosis. So in order to get histopath sample of that like this plastic endometrium, I have to do a DNC. So the answer to that question will be dilatation and curettage. So these management kind of questions are what will be asked in surgery and OBGYN, and if you're thorough with it, then it will put you ahead of other people. Apart from them, definitely the first prop subjects, they are important. तो फर्स्ट प्रॉप सब्जेक्ट्स एंड उसके अलावा OBGY एंड सर्जरी, क्योंकि इनके क्वेश्चन सॉल्वेबल भी होते हैं, अनलाइक ऑफ्थैल या ENT. ऑफ्थैल ENT इज वेरी एलियन एंड यू शुड नॉट थिंक मच अबाउट इट, जस्ट लीव इट अगर नहीं समझ में आ रहा है तो. बट सर्जरी एंड OBGY is something which is pretty much solvable. You can get a very high strike rate. You should have to be just thorough with the management, the various surgeries. Like when there was another question where there was a CA head of pancreas, but it had metastasized to liver. So in such case, we will not do Whipples. We will just do a palliative surgery. So that was the answer, and not Whipples.
So basically, understanding the concept behind whatever we are reading, rather than just mugging up the facts, is the key, right? And so you mentioned that some books have given a wrong answer to that particular question of the endometrial sampling. How did you realize कि ये इसका आंसर गलत है और इसका सही आंसर ये होना चाहिए? How did you realize that?
Actually ये जो क्वेश्चंस, जैसे जो भी कोचिंग क्लास अभी आपको नोट्स प्रोवाइड कर रहा है, वो इन्हीं पास्ट ईयर टॉपिक्स के एक्सपीरियंसेस पे मटेरियल ऐड किए हुए हैं. So it was given in I had read from Marrow, so it was given in Marrow, and then I had cross-checked it from DAMS exclusive club. If I used to have any doubt कि मुझे आंसर में गड़बड़ लग रहा है, I don't feel this is the right answer, because notes में ऐसा नहीं दिया है, तो I used to use DAMS exclusive club, and even a lot of other new platforms also have their own Facebook group where you can directly ask the faculty doubt. So the faculty will answer that.
Okay.
So that is how I came to know.
Great. And the next question that we have, so Girdhar is asking, since there's latest 28th edition of Baileys, so will the updates will be asked in INI-CET? कितना focus करता है INI-CET on these updates?
Actually, there is one video by Amrit Nasta sir where he has taken a YouTube class on all the relevant and important Bailey updates. You should go through them. The reason is because the chapter of breast in 20th edition of Bailey has been written by the faculty of AIIMS only. So they can ask. There are changes, but you should not know all the changes. You should know only the exam relevant changes. And I think Amritsar Nasta sir has taken a class on YouTube where he has covered all the major updates of 20th edition of Bailey.
Okay. Next question is by Sharon, and that's a relevant one. Multiple revisions is more important, or rather going to PYQs before 5 years? What would you prefer? कि भाई 5 years के PYQs करो और अपना notes content बस revise करते रहो, या rather go to the previous year PYQs and leave your notes and content side में, पहले 10 year के करो?
What he has to do is do the revision of only PYQ topics. तो अगर आप अभी surgery revise करने के लिए बैठे हैं and you see a previous year question कि they have asked management of papillary CA of thyroid, so you will read only papillary CA of thyroid. If they have asked a question on cautery, then you will read the topic of energy devices from your basic notes only. If they have asked to identify a particular suture, then you will read the topic of suture which is given in your notes. That is how you will revise surgery. You are not going to read everything in surgery. You will read only those topics in surgery which has been asked in the exam.
Right. So basically, so you've said it's a mix of both. Understanding that what you need to revise from your notes is what has been asked in the previous year. That's all that needs to be done. Okay, so
Yes.
that was a great suggestion. And next question I want to ask, do you have any secret resources that you would like to share with students? You know, ये book शायद किसी को पता नहीं है, but it's very very useful. First aid तो एक है ही, like which has a lot of buzz going around. Is there any other book for MCQ practice or for concepts clearance, anything?
Ma'am, as like the trick to crack the entrance exam is very simple. You take one source and you revise it till death. That is the only trick.
Okay. So because you know I realize along my way when I prepare for lectures कि अरे ये resource कितना अच्छा है. Like physiology के लिए now I recommend a lot of students BRS physiology, and that's a very super awesome book.
No, I have read BRS physiology, but the time to read such books is during the respective year of MBBS, not now when there is a severe time crunch. Because even if you read BRS physiology, you will आप मैक्स टू मैक्स एक ही ज्यादा क्वेश्चन करेक्ट कर पाओगे. जो बल्क ऑफ द क्वेश्चन है वो आपके कोचिंग के नोट से भी सॉल्व हो जाएंगे. सो इफ समबडी वांट्स टू रीड BRS physiology, they should read it when they are in first year MBBS, or you know, not when they start their main entrance preparation. उस टाइम पे तो they have to use a concise material which they are able to revise.
Okay, so probably we can have a next session dedicated to those students who are in their undergraduate days कि क्या करना है और कैसे करना है. So just out of curiosity, like have you always been a topper student in your MBBS days as well?
Yes.
So I very much could gauge that. That's amazing. But does that mean at the same time कि only topper students can crack INI-CET?
Definitely not. Cracking exam requires a strategy. One of my senior who used to guide me in science, he always used to tell me कि topping in the university exams does not always mean you will be able to crack NEETPG. And I have seen several such examples in my college. But he himself was an example where he said that you have to follow the strategy. Like you don't have to be an exceptional to crack the exam. You have to follow what the majority herd is doing, like reading the notes again and again and giving GTs, working on your mistakes, and you will ultimately crack it. Like my senior, he had gotten an All India rank of 99. So now he's pursuing his DM in medical onco in Tata. So he used to always guide me. So he told me the same thing, that topping in college exams is different, and entrance exam के लिए you have to follow what the experienced faculties on various platforms tell you. You just follow them blindly, you will get through it.
Absolutely, I agree to that totally. Abhilasha has put this query so many times and we need to answer this. How to approach for very long time consuming questions for correct answer in less time? Abhilasha, we are answering that query.
Yes, so when you see such a long stem question, give it one read, see the options, see if you are able to boil down to two options. If yes, then spend more time and mark the answer. अगर उसके बारे में कुछ भी क्लू नहीं है, दो ऑप्शंस पे भी आप नहीं रूल आउट कर पा रहे हैं, तो इट्स बेटर कि उसको लास्ट में देखा जाए, क्योंकि इंस्टेड ऑफ वेस्टिंग टाइम ऑन दैट क्वेश्चन आप 3-4 वन लाइनर्स मोर करेक्ट कर लोगे.
True that. So I hope that answers the query for Abhilasha. And next, if I just ask you rapid fire sort of thing, if you can just tell us top 10 topics for INI-CET, just randomly whatever comes to your mind. I know that this is very, very impromptu, but I believe that you would be able to answer more than 10.
So I'll say subject wise in anatomy, cranial nerve, foramen are important, especially the identification in cadaveric based image, and muscles of mastication. I think I've already said these are very frequently asked topic, and the arrangement of various structures at hilum of various organs, like how is the structure arranged at renal hilum, how is the structure arranged at the lung hilum, the porta hepatis ka arrangement, intercostal ribs mein arrangement. So these are the kind of questions which are repeatedly asked. In physiology, they ask a lot on general physiology, nerve and muscle, and renal physiology, so you should focus on that. Biochemistry, a lot is recently being asked on vitamins, so you should give a more thorough read to vitamins, and all the cycles you can revise it. What I used to do is I used to revise one cycle every day. It hardly takes 10 minutes, while doing breakfast or something. So biochemistry, you need not revise in bulk. You can just do one cycle one day, and by the time exam comes, you would have done all the cycles at least 2 to 3 times. Pathology, definitely more than systemic, general pathology and hemat, especially go through all the questions, and the approach to anemias is like how you will say this is iron deficiency, how you will say this is thalassemia. And we don't get calculator in exam to calculate Menster index, and also उसको बार बार देख लो, एक आइडिया लग जाएगा उसमें. Pharmac, I feel general pharmac and ANS and antimicrobial still form the crux of the exam. The newer drugs, if you have already read it pehle, then you read it. Otherwise, you don't bother much about it. It's not going to give you much of gain. Like you can read antimicrobials in that. In microbiology, definitely the topic of fungus and parasites, the life cycles. With one cycle of biochemistry, I used to do one cycle of the parasite. We do the life cycles from CDC. The CDC ones are only put in the exam. And in FMT, it will be the toxicology and the images of various injuries, like how does a hesitation cut appear, how does a split laceration look, how will you differentiate split laceration from incised laceration and all. Ophtha, I would say just go through the images of all the fundoscopic images, at least the classical ones. For ENT I feel is asked very vaguely, so one can actually skip ENT, but in ENT the radiological anatomy of paranasal sinuses is being asked very recently. So there was one you should be, the trickier part is to identify whether it is anterior ethmoidal air cell or a posterior ethmoidal air cell on a coronal section. So you just have to see whether you are able to see the maxillary sinus or not adjacent to it. अगर maxillary sinus दिख रहा है, mark anterior ethmoidal. नहीं दिख रहा उस cut में, तो mark it posterior ethmoidal. So radiological anatomy of paranasal sinuses are asked. In PSM, definitely the health programs, and instead of focusing more on the newer health programs, AIIMS will still ask you about TB and HIV. So TB and HIV is something which has to be very thorough for PSM. I think rest of the subjects more or less, surgery, I have said general surgery, breast and endocrine, and in GI surgery, hepatobiliary is what the area of focus is. In medicine, medicine is again asked very vaguely, but acid-based disorders, management of various electrolyte abnormalities, and stroke, that is very important. And OBGY has a very clear-cut topic list. All of them are of equal importance in no particular order. OBGY and surgery has to be done thoroughly.
So you've stressed enough on surgery and OBGY, so we get that those need to be mastered based on the previous year topics for sure.
Previous year topics, and mastered based on management wise. Like you should know that identiform mole of any week of gestation has to be managed by suction and evacuation only. Cervical intraepithelial neoplasia in any like she can be a 79-year-old female, still you have to do an like large loop electrosurgical excision. You will not do hysterectomy for it. So these are the, these are something which I learned over a period of time, making many mistakes. So OBGYN surgery, yeah, management has to be very thorough for it.
Okay, so I think we have answered the majority of the queries. For students who are putting the queries related to first aid, how many questions to attempt, how many to get correct, I believe you have joined in late. We have answered all of those queries. And another query, see, no matter however your performance, whatever your rank has been in NEET PG or the previous exams, that is just a past. Leave it in the past. You can definitely change your future. Yes, Akanksha, I hope you would agree to that. पिछले एग्जाम में आपने कैसे परफॉर्म किया उससे कोई फर्क नहीं पड़ता.
कोई फर्क नहीं पड़ेगा.
Absolutely. So thank you so much, Akanksha, for those valuable insights. I believe myself and everybody here, we have got to learn a lot from you, and we wish you all the best for your future life as well. And hopefully we will keep meeting again and keep guiding our junior batches and tell them the right strategy. Thank you so much again for giving us your valuable time.
Yes. Thank you, ma'am. Thank you for giving me this opportunity. And anyway, like I am present on all social media, so if anybody has any doubt, they can directly, DM me on Instagram, or just I have my own Telegram group also, though it's not active much. It's called Inquisitive Minds by Akanksha. So you can put a query over there, or even on Twitter. Like I reply to almost all the queries if anybody has anything.
That's great. So I'm sure everybody would stay connected with you. And again, thank you so much, and see you again soon, Akanksha. Thank you.